I wanted to become a doctor because my family has a long line of healthcare workers, but not in the traditional sense. My mom was an aerobics instructor, so while I was in her belly, I was in aerobics classes, and when I was in a walker, I was in aerobics classes. I chose to specialize in OBGYN, honestly, because I said I would never do it, and I realized once I left the rotation that it was the only thing that fit. I went to surgery, loved it, but realized I loved women's health care. I have a ton of women in my family who have a broad range of healthy to morbid obese to diabetes with amputations, and so it just fit that I would work with women and women's health. My approach to patient care is teaching my patients to advocate for themselves. I am a big proponent of education, and I believe that if a patient has the education, the why things are happening, then they're more likely to treat it and treat it in their own way. The type of patients I typically see are people aged 10 all the way up to 90. They are reproductive age, pregnant, approaching menopause, postmenopausal. The thing I enjoy most about being a doctor at Tanner is the wide variety of patients that I get to see. I enjoy meeting new people, and I enjoy the conversations that I'm able to have. Tanner has cared about me as a person. They've started me off with a very reasonable patient load, and I just really get to develop my practice in that way. And my patients actually get to know me as a doctor because I have more time. And so I think that was something that Tanner did a great job on and really thought about. Something unique about my practice is that I believe in holistic care. I believe in taking care of the person as a whole. In that way, we can't treat the disease if we're not treating the whole person. Also, in regards to that, you are not your disease, you are not your illness, you are so much more than that. And so I believe that to tackle the thing that we're focusing on, the problem that you're having, we really need to get to the bottom of all the things. The thing I want my patients to take away from a visit with me is education. Absolutely. I want them to know it's okay to ask questions, especially of me, but I want them to go out and ask questions of everyone else too. I really enjoy working with medically underserved populations. That's women, that's LGBT, that's young, old, and I want those folks to feel like they can ask questions and really advocate because no one knows their body like they do.